Good morning, everyone. I think we're going to get started for today. So welcome to the second annual Precision Health Symposium. My name is Vicki Ellingrod. I am the Associate Dean for Research and Graduate Education in the College of Pharmacy and one of the co-leads of the Precision Health Education Workgroup. We're very glad that you joined us here today. I think we're going to have a very full and exciting day for you to participate in. Precision Health at the University of Michigan launched just over a year ago, and we have focused on quickly developing infrastructure and support for all of the various programs that impact all aspects of U of M's mission: research, education, and practice. This day is set aside to celebrate accomplishments, learn from colleagues and experts, and develop a greater sense of community around precision health. We feel very fortunate to have strong partners from across campus who share our mission for developing a leading precision health program, including Michigan Medicine, the College of Engineering, the School of Public Health, the College of Pharmacy, and the Provost's Office. Thank you to all of our key partners. Our agenda today includes guest speakers, a research panel, a fireside chat, a poster session, a speaking competition, which you're going to learn about in a little bit, and much more. During breaks in the lunch period, please make a point of visiting these special areas that are located in the back of the room. At the registration desk, you can learn about Precision Health's new member program and its benefits and apply for membership. I promise the application process won't be too competitive, so please apply for membership. At the back of the room, we have representatives from the Department of Learning Health Sciences, which is our new home for our very exciting graduate certificate in precision health. So please stop by and visit them, as we're going to be accepting applications now for the fall of 2019. Also in the back of the room, there's a table where you can learn about the tools and services available through Precision Health Analytics platform. We have a lot of exciting developments, and you'll hear more about them momentarily. And then over to my left here, we have the photo zone for people that love to have their picture taken like me. At the photo zone, you can get a free professional headshot taken by an award-winning photographer, so please go over there. We're really glad to have you here today because we're genuinely excited about the quality of the presentations, the speakers that we have, and this opportunity to continue to develop the precision health community here on campus. If you need anything while you're here or you have questions, please talk to any of the Precision Health staff. They're wearing staff ribbons on their name tags, and they have a lot of information to give you, as well as information that is presented in your program, including the location of the restrooms. But I'll give you the cliff notes to that. The restrooms, you go out here, take a left, and then take a right, and they're down the hall. So we have a full day of fascinating speakers. We'll make every attempt to keep things running and on time, and we ask that you help by keeping breaks and the times limited. Before we start, though, I have a few housekeeping tasks. First of all, this day would not have been possible without the wonderful Precision Health staff. Especially, I would like to thank Tina Krazier and Rachel Dawson. Could we please give them a round of applause? Additionally, our Precision Health Education Workgroup, which is co-chaired with Veronica Barakel, also includes Gretchen Piat, Bev Yashtar, Ivo Denove, Scott Roberts, Tiffany Vinote, Maureen Sarter, and Amy Cohn. Thank you all for your efforts in planning this event. Please give them a round of applause as well. Additionally, I've been informed that all of your tableware is compostable, so please put it in the appropriate bin and save our planet. And then lastly, please silence your cell phones while you're attending the symposium. We would love to have our speakers be uninterrupted by the latest Cardi B hit or whatever is on your phone, so please make sure that they are on silent. And now it's my distinct pleasure to welcome one of the co-directors of Precision Health, Dr. Sachin Kheterpal. He is a full professor of anesthesiology, as well as serving as the Associate Dean for Research Information Technology in the medical school. He has been engaged in precision health work at the University of Michigan pretty much since the beginning of this initiative and was the driving force behind the establishment of precision health at the University of Michigan. He is going to give us a quick overview of precision health at Michigan. Dr. Kheterpal.
Thanks, everybody. Thank you, Vicki, and I want to give a round of applause to Vicki for really making this happen. When we talk about gathering an event like this, it's not easy. There's a lot of cat herding, and I'm one of the cats involved typically. So thank you for making today happen. I wanted to give a quick overview of what precision health is and what's happened in the last year. I think at this point, this slide is probably imprinted on many people's retinas because we've used it to really communicate what we're trying to achieve, what the components of precision health are. And I want to remind folks where we started and really assess ourselves to see if we've made progress. Precision health is composed of 5 elements. I'm showing 4 right now. One is community development, which is about expanding the community of participants that are sharing their data, participating in research, and willing to engage with the research community at the University of Michigan. Data analytics and IT is building the analytics platform, the data elements, the secure places where you can compute with these data elements and bring your own data in as well. Health implementation is taking these exciting discoveries and actually trying them out with willing and interested participants at the point of care at Michigan Medicine and statewide and trying to make an impact on health throughout the entire state. And the education and training work stream is designed around creating a new workforce and educating our current workforce on how to actually deliver what we call precision health. Layered on top of those 4 work streams is the actual research itself, a grants program, and also specific use cases, the first of which was the opioid misuse use case scenario itself. So how have we done? You've seen this slide a couple times in the last year. Have we made progress? And this is something every initiative and every university must do, is when we have these big press releases, have these announcements, are we making progress? And it's exciting to say, even though when we're in the trenches of weekly meetings trying to make progress, it feels like things are moving slow occasionally. When I look back now over the last year, what's happened, it's amazing how things are different, how much more of a real platform we have, and how much more of a community we've built out of this. On the community development side, the Michigan Genomics Initiative has now expanded to over 65,000 University of Michigan patients who've consented to share their data, their biospecimen, and to be recontacted for studies. That was about 15,000 more than we were just a year ago. We've now started a study called MyPact, where we're giving people a wearable and a blood pressure cuff to actually go beyond our classic electronic health record and biological concepts of what a patient's experience is. And we've made great strides in improving the diversity of our cohort as well. In the education and training work stream, as Vicki mentioned, a huge achievement, which is we now have the nation's first precision health graduate certificate program available for applicants starting this fall, administered through the Rackham School. Symposiums like this, weekly, monthly seminars, and really creating a community of scholars, some of whom you'll be hearing from later today. On health implementation, we've gone from machine learning and AI being buzzwords that you hear about at talks like this to actually starting to affect daily interaction. So now, when someone has an exciting proposal for, hey, I saw this new way for us to risk adjust or risk stratify and really give the right care to the right patient at the right time, that great idea doesn't have to go through all the obstacles that it used to, because now we've got real-time data access available to validate these potential discoveries. And we've worked with Michigan Medicine clinical leadership to figure out a pathway to go from great idea to actual patient care impact, and those obstacles have been overcome significantly. On the research side, we've got many of our scholars and investigators here today. We've spread out about $4 million in investigators and scholars awards. And due to the success of the first opioid misuse use case, we've actually now launched a second use case on mental health. And then finally, as you heard just a moment ago, today we're launching our data and analytics platform campus-wide, which has been in the works for about 1.5 years now, and got additional data cleaning and data types available in there. So at lunchtime, please do stop by that area. This is an exciting new platform available to campus researchers with a level 1 password, no level 2 password required anymore. It's not just software, it's people also, scientific facilitators to help you through and actually understand what the data is, what the data can't do, what it can do. Use a de-identified data set of those consented 65,000 participants if you've got the IRB exemptions in place, and interact with the 4 million patients in a completely de-identified feasibility cohort development perspective as well. We've got genetic and clinical data linked together in that area, and people to help you through that process. These achievements let us know that we're heading in the right direction. Lots more to do, lots of bumps that we found along the road. But part of this initiative is really figuring out what it takes to bring an entire university together, not just a medical school, not just a couple of the health science schools, but to bring us all together, engineering, pharmacy, public health, the provost's office, to really make progress. And it's been a really exciting experience to learn from our colleagues around the university. With that, I'll stop and introduce really someone who's been a champion for precision health at the University of Michigan, which is Dr. Marschall Runge. He is the Executive Vice President for Medical Affairs at the university level, the Dean of the Medical School, and CEO of Michigan Medicine. Marschall, thanks for your support.
Thank you, Sachin, Vicki. It's my pleasure to have the opportunity also to welcome you to this Precision Health Symposium. I think this is a great thing, and as I think about what has occurred over the last year or two, it's really amazing progress, and that's due not just to the leaders you've heard from, but to many of you. And I think the future is so bright for what we can and will do, because we have many resources, many approaches that aren't available at many different institutions, and they're in one place, and there's a collegial and collaborative spirit here that extends far beyond this campus that I think can help us understand disease in a much better way than we ever have before. First of all, I have I guess this is a sociological question. How many of you chose blue socks versus white socks? I think that says something. I'm not sure what it says, so maybe we can have a small project in mental health on that. What I want to make just a few comments. The first is this is a very exciting day. Great speakers. We have a wonderful outside speaker, a wonderful inside-outside speaker, and I think it'll be an exciting day. I think the poster sessions, and I'll be very interested to hear about this speaker. What did you say that was? The competition. That should be quite interesting. But the most important thing I want to emphasize is what I think is the strength of what this program represents. And really, ideally, it will represent all 19 schools and colleges on our campus, because each of them have expertise. They have experts and expertise in areas that undoubtedly affect health that we don't think about. I don't think about it in medical school, but I can recognize when somebody brings it forward, and hopefully we'll hear a little bit more about that from our later presentation. And so it's that rich and productive and I think really innovative approach that will give us insights into not just into disease, but how to enhance health. Part of which is preventing disease, but part of which is enhancing health as a whole. And that's why I think our program, the program that you're all involved with, has already made some important strides and has the opportunity to make breakthroughs that will stagger all of us in terms of what kind of impact we can and others can have in health. And during the process, learn from what people are doing at many other places. So thank you for being here. Thank you for participating in the important discussions that will happen today. And I hope you enjoy this day. And go blue. Blue sock.